This is a special Action News Jax presentation. The coronavirus, fact versus fiction.
Good evening, I'm John Bachman.
I'm Tanika Hughes. From its emergence in late December in China to tonight, the coronavirus has killed thousands, disrupted global economies, and ignited health emergencies across the planet.
As each day passes, the numbers do increase, as do the chances of a local outbreak.
Tonight, we're providing a voice of calm while we take a closer look at how the infection spreads and what our leaders and brightest medical minds are doing to keep our country safe. And most importantly, we're helping to separate fact from fiction. We have complete live team coverage. Our crew's breaking down how the virus is affecting things that affect us. That includes our schools, travel, businesses, and other aspects of daily life. And let's begin with the very latest numbers on the spread of the virus. According to data from the CDC and the World Health Organization, there are more than 92,000 cases worldwide. More than 3,100 of those have been deadly. In the United States, there have been 108 cases across 15 states, and 6 of those in the U.S. have been deadly. In Florida, there are now 3 cases, 2 in Hillsborough County, 1 in Manatee, another presumed case as well. In Georgia, there are 2 cases in Fulton County and Metro Atlanta. Action News Jax is first to tell you that the Duval County health officials were monitoring less than 10 people in our area for signs of infection.
So what is the coronavirus? It is a type of virus that's similar to the common cold, which affects a person's respiratory system. They're named for the shape of the virus, which looks similar to our sun. They're transmitted from animals to people, people to people. The latest data shows that those most susceptible are the elderly, those already sick, and those with compromised immune systems. This strain is called COVID-19. CO stands for corona, Vi stands for virus, D stands for disease, and 19 for the year it was first identified. The virus spreads similarly to influenza. The first is person-to-person contact through coughing and sneezing. The virus hitches a ride on droplets of water. Kissing would definitely spread the virus. Sexual contact, not clear right now. The CDC recommends 6 feet of separation between you and an infected person. That's exactly what you see from this part of the tape measure to the end of the monitor there. The second way is by coming in contact with an object touched by an infected person. The virus can survive on metal, glass, or plastic anywhere from 2 hours to 9 days. A simple disinfectant will kill the virus. Just in the last hour, we learned that the Duval County Supervisor of Elections will be training staff to continually disinfect voting machines. And as for food, the virus could hitch there as well, but heating or reheating food will kill the virus.
A live look at Jacksonville Beach shows warm, dry conditions, and a lot of people may be wondering how weather could impact the spread of the disease. Let's bring in Action News Jax First Alert Chief Meteorologist Mike Burge, helping us to separate fact from fiction.
So the role of weather and the coronavirus, and let me emphasize first and foremost, we're not certain on this, but the CDC is hopeful at least that warmer weather will slow the spread, which is typical for most viruses. However, this is a new virus, and the U.S. population is susceptible because it's a new virus. And lastly, it could be quite possible that the cases would once again begin to accelerate late next fall and into the winter as temperatures turn cold again.
Let's take a look at how COVID-19 measures up to other recent viral outbreaks. In 2003, we dealt with SARS, severe acute respiratory syndrome. There were 81,000 cases, more than 700 deaths, and in that case, the fatality rate was 9.6%. Let's take a look at MERS now. This is from 2015, the Middle East Respiratory Syndrome. There were about 2,500 cases, nearly 900 deaths, but the fatality rate was much higher here at 34.5%. Now let's take a look at COVID-19, the coronavirus disease that started in December of 2019. So far, more than 90,000 cases, 3,000 deaths, and the fatality rate is much lower at 3.4%. And what about the flu? Let's take a look at this. So from 2018 to 2019, looking at cases in the United States, more than 35 million cases reported in the U.S., more than 34,000 deaths, with the fatality rate of 0.09%.
We still don't know everything about COVID-19. Scientists still trying to figure out at what point a person becomes contagious and how long after infection they remain contagious. What they can say, though, is what happens to the body after infection. For most people, it feels like a cold. Within as soon as 2 days, patients develop a low-grade fever, a dry cough, experience difficulty breathing in some cases. They may also feel body aches and develop gastrointestinal issues with some diarrhea. Those symptoms could last up to 2 weeks. For patients who develop severe symptoms, their fever could jump to over 100 degrees. They could develop pneumonia. Others could experience kidney or multi-organ failure, and that could cause death. Scientists are still working to figure out why some cases are worse than others.
Local doctors say they are prepared to treat coronavirus patients, and they showed Action News Jax Bridget Matter step by step what it takes to officially confirm a coronavirus case.
Hospitals can't test for the coronavirus. There are several steps a patient and their doctor will go through before it's confirmed they have COVID-19. First, anyone who's visited a country under alert or been in contact with someone who has symptoms of the virus should skip the ER and go straight to their doctor. People will be tested for the flu and common cold, among other respiratory illnesses. If those are negative, an on-call number with the county health department is called. The doctor explains symptoms and patient travel history. The county health department will make recommendations to the state health department for testing. Then the state health department decides if samples should be collected. If so, the hospital collects samples and it's sent to one of 3 state labs. If positive, the sample is sent to the CDC to confirm it is COVID-19. Then the hospital and State Department of Health will discuss further treatment plans for the patient. We went to UF Health and spoke to the director of infection prevention. We asked him why the exact number of people being monitored for coronavirus here in Jacksonville is not being released to the public.
I don't think that anybody's necessarily hiding anything from the public at this point. We're just trying to get a good handle on it because it's a rapidly evolving situation.
Chad Nielsen says while the spread of the virus could still be a pandemic, there's no need to panic. He says most people who are infected recover.
The everyday healthy person, they're being discharged from the hospital within days, on fluids and other kind of supportive therapy.
Bridget Matter, Fox 30, Action News Jax.
And Action News Jax found that children are less susceptible to COVID-19 than adults. Actually, the CDC says infection in children relatively uncommon. Compared to adults, symptoms in children may be more mild than the general population. According to limited reports out of China, the CDC says children with confirmed coronavirus have experienced a fever, runny nose, and cough, whereas adults may also experience shortness of breath. However, children with underlying health conditions could be more at risk for more severe infections.
Action News Jax going county by county now to bring you the latest information on school preparations. We reached out to every local school district in Northeast Florida and Southeast Georgia to find out how they are protecting students against a potential outbreak. About 3 hours ago, Duval County put out some new guidelines, and those include new steps if a student has been traveling out of the country. There's also a process for new student enrollments from high-risk areas. Starting tomorrow, the district will begin specifically disinfecting schools and be ready for rapid response to cleanse should an outbreak occur. St. Johns County sent out a list today. It shows 7 ways the district is working to prevent an outbreak. That includes sending sick kids home immediately, increased cleaning by custodial staff, and monitoring changes in absences.
At first it's a little scary, but then you know that they're trying to make sure that your kids are going home safe and trying not to catch anything, because I'm sure they all have kids too, so they don't want to catch anything.
We put more information from each school district plan on actionnewsjax.com. Each one has information on what they're doing now and what would happen if it spreads to other districts.
The message from experts is clear. Using surgical masks really won't do you a whole lot of good in preventing getting sick from the coronavirus. These masks should only be worn by the sick or those already caring for people who are sick. All right, so what about respirator masks? Well, again, not something that they recommend. They should be only used by healthcare workers themselves because they are required to get special fitting and training to use them. So what can you do? What's the best way to protect yourself? It's simple, folks, something you should do anyway. Wash your hands for at least 20 seconds. Use hand sanitizer. If you have to cough, cough into your elbow. Don't cough into your hands because then you're just spreading stuff. Don't touch your face for the same reason. And if you're sick, stay home. Stay home. And don't go to public places like work and even the ER. And if you are sick, call your doctor.
Supply and demand issues are causing price increases for face masks, Hand sanitizer, Lysol wipes. Action News Jax Elizabeth Pace shows us how to protect your health and wallet.
An hour after the city of Jacksonville confirmed some patients are being monitored for the coronavirus, I found Kayla Duke walking into a store to stock up on supplies.
I think it's a little scary, but just gotta take your precautions.
Duke is with her little boy and pregnant with her second child. She says her family just had to talk about taking precautionary steps against the coronavirus and the flu.
Getting hand sanitizer, getting some waters, and maybe some Lysol spray, and just being careful like when we touch carts and being out in public.
Right now, it's hard for local families to get their hands on basic items like hand sanitizer. I found major retailers like Target are still selling it for cheap, but some stores are sold out. After looking at some of these prices, I decided to find if any of these items are still available. So I walked in this Super Target behind me with my cell phone, and I found that all hand sanitizer, Lysol wipes, and face masks are completely sold out. These shelves were empty. A Target employee told me it's been sold out for days and is unsure when another shipment will come in. So I did a quick search online and I found some products are still available through Amazon, but for a hefty price. This small bottle was priced at about $247. I checked with Amazon to ask if it's watching for price gouging and was told Amazon is taking action on accounts that violate its policies. For now, remember, good old-fashioned soap and water is still cheaper and what doctors recommend. Reporting on the South Side, Elizabeth Pace, Fox 30, Action News Jax.
And there are families here in Jacksonville worried about loved ones living overseas.
Action News Jax Dawn Lopez spoke with a local business owner from China about her concerns, not just for family members abroad, but those at home.
Trying to say, oh, we are fine. No, we are not fine.
A very worried Win Rady owns Leaf and Bean restaurant off Beach Boulevard.
Every day is a change. Nobody knows what's going on.
For 3 months now, she has watched for new developments on the news out of China, but most of the information comes from video chats with her family.
One person go out to buy the food and drinks, and I had to wear the mask.
And even though her family's home in China is hundreds of miles away from the epicenter of the coronavirus outbreak, it's still impacting her family. WIN is a big part of Jacksonville's nonprofit Sister Cities, a network that develops a relationship with other member groups all over the world. Jacksonville's membership was supposed to visit China this coming May.
We probably would not be able to go.
The Chinese community here in Jacksonville is coming together to send relief directly to Chinese hospitals.
And we see what they need over there, like masks, here, other medical supplies.
But her concern over the impacts of the virus extends now here at home as more Floridians test positive.
You asked me about China. I said, no, I'm not worried about China anymore. They are really good, doing, and after three months, they pretty much, knows what, handling really well. They know what to do. We don't.
Wynn says that she's reminding staff to keep their hands washed and gloves on while serving customers. Hand hygiene is the #1 priority, and we all can practice that to keep ourselves healthy from the coronavirus or even the flu. In the studio, Dawn Lopez, Action News Jax.
Coming up on coronavirus, fact or fiction, debunking myths, what experts are revealing about millions of packages heading to our country from China.
Plus, researching a vaccine and other treatments, the hurdles doctors are facing to protect public health.
We now return to a special Action News Jax presentation, The Coronavirus, Fact versus Fiction.
Well, there is a fair amount of disinformation circulating about the coronavirus.
We continue to break down fact versus fiction, and here's one. Packages shipped from China could be infected.
That's fiction. The virus cannot survive long-term on objects like letters or packages. Another conspiracy theory online is that the virus was created by people.
Yeah, that's also fiction. It's very common for viruses to mutate inside of animals and jump to human host, and that's likely the scenario for what happened here. Here's another one, that there's a vaccine that already exists that works.
False. Scientists are working on that now, but it could be months before it's developed and even longer before it's ready to be administered to the public. Right now, the race is on to get that vaccine to fight COVID-19.
The timetable is tight to create it, test it, and produce it in bulk.
The federal government says the coronavirus risk is low in the U.S., but it is still working to eradicate the virus. And that is underway at a biotechnology company in Cambridge, Massachusetts called Moderna.
Our first study was against a strain of flu called H10. Our second study was a strain of flu called H7. And we've since then shown that the technology, the mRNA vaccine technology, can immunize people.
Moderna staff tells us because of their successful track record, the National Institutes of Health gave them a grant to start developing a vaccine for coronavirus.
I'm going to take just that part of the virus that your body can recognize, and I'm going to show it to your body. I'm going to teach your body to make that protein so that your immune system can recognize it and say, hold on, I've never seen that before. Let me make antibodies against it. Let me protect myself. That's how your immune system works. So that now, if you're walking down the street and somebody sneezes on you and it happens to be this virus, your immune system is going to go, wait, I've seen that before.
Their lofty goal, to give the government a vaccine in less than 2 months that is large enough to test in clinical trials. And you've heard a lot of talk about the rush to create a vaccine to fight COVID-19, but tonight we're giving you an inside look at the first clinical trials to treat this respiratory infection.
Action News Jax Paige Kelton takes you inside the biocontainment unit treating U.S. patients and talks to the doctors in charge of this research.
Right now, researchers at the University of Nebraska Medical Center are testing an antiviral drug, remdesivir, to treat people with severe symptoms of coronavirus.
This is a look inside the biocontainment lab where patients stay. It's the first U.S. facility to take in patients with COVID-19. It's important for you to know that, like the flu, not everyone who's infected has serious symptoms. In fact, most people get over it in just a few days.
As you know, 80% of the patients with this infection do have mild disease, and they will recover without any really specific therapy. We are aiming to offer this trial to patients that progress to a more severe disease.
I spoke over Skype with Dr. Andrew Khalil. He's leading the testing of an antiviral drug called remdesivir. Doctors are also pairing that with other medications to see which combinations work best in people who have severe symptoms.
This adaptation process will allow us to rapidly test several therapies in the same trial.
Doctors at the University of Nebraska hope these trials help pinpoint a specific treatment we can use for COVID-19, just like how we use Tamiflu to minimize the flu's impact. We'll continue to monitor the progress of this research and keep you informed. In the studio, Paige Kelton, Fox 30, Action News Jax.
The new coronavirus went undetected for weeks until health workers finally found out what the new sickness was. On December 31st, cases of pneumonia in Wuhan were reported to the World Health Organization. The cases happened between December 12th and 29th. A week later, scientists formally identified the new coronavirus. Then on January 11th, China reported its first death.
The CDC says there will likely be more cases in the U.S., gave us access into the room where critical information in the fight to control the disease is being shared. These CDC workers are concentrating. It looks like they know they are on a serious mission.
We have about 800 people working full-time on the issue, and about a third of those people are not even in Atlanta.
Around the clock, the CDC's Emergency Operations Center is focusing mainly on the coronavirus.
Break us out of the usual bureaucratic way of doing things and to be able to streamline our communications as quickly as possible.
They're communicating with health workers around the world. They're also coordinating with many agencies, including the Department of Defense and Health and Human Services. These workers help equip and send workers to airports where screening is happening. Then there are workers who focus only on the virus, which was only first discovered in China 2 months ago.
Epidemiologists that are looking at the data that we're getting on the disease, trying to figure out, how are we going to deal with it? Are there any similarities between cases in different locations?
And right now, the Pentagon says our impact to service members is minimal.
That's not surprising because we have a very young demographic in the U.S. military, healthy demographic, lots of immunizations and so on and so forth. And we hope to keep it that way.
However, the military is modifying some of its exercises with South Korea.
Still to come on coronavirus fact or fiction, travel concerns, what local airports are doing to protect passengers, and what you should do before booking tickets.
We now return to a special Action News Jax presentation, The Coronavirus, Fact versus Fiction.
The U.S. has increased travel restrictions for people coming back into the country from certain areas. Anyone who has returned from China, Iran, South Korea, or Italy needs to stay home and monitor your health for 14 days. The CDC also advising taking your temperature with a thermometer twice a day. Senator Rick Scott is calling for increased screening at all Florida international airports. Action News Jax spoke with Matt Thomas, traveling to New Hampshire from Jacksonville's International Airport. He says he plans to stay calm, watch the news, and continue to wash his hands a lot.
Hopefully it'll run its course, and people will develop immunity to it over time and won't have to worry about it anymore. Hopefully.
That's a wise take right there. If your travel plans are going to bring you through JIA, you'll notice more hand sanitizing stations. The CDC says the risk of infection on an airplane is low, but you should still try to avoid sick passengers and wash your hands often with soap and water for at least 20 seconds. The demands for travel insurance have surged amid the spread of the coronavirus. According to travel insurance site Insure My Trip, there has been a 60% increase in policy sales since January 21st. That specifically includes cancel for any reason coverage. That particular upgrade is the only option to cancel a trip due to the fear of getting sick.
The Federal Reserve cut interest rates by 0.5% today in response to the growing economic threat from the coronavirus. The markets did not perform well at that news. The Dow went down nearly 800 points. The Nasdaq and S&P 500 took some big losses. Any gains we've seen this year have been wiped out in the last week. To help you further separate fact from fiction, the Florida Department of Health has opened a hotline for you to call with more information. It can be reached by calling the number on your screen, 866-779-6121. People can answer your questions between 8 a.m. and 5 p.m. Monday through Friday.
Action News Jax continuing coverage of the coronavirus is available anytime on our free app. You can find an interactive map of cases, links to state and federal resources, and information on how the virus can spread. Thank you for joining us as we work to calmly bring you the latest information on the coronavirus and the response to it.
We'll see you again tonight on Fox 30 at 10 and at 11 on CBS 47 and Fox 30.